Welcome back, it's Dr. Somji.
Hi, I'm Elli.
She's been practicing aesthetics for, over a decade, right?
Yeah, over 10 years now.
So she knows everything there is about skin. She sees a lot of the patients that walk through the doors at Dr. Melly's Spa. And we've got a treat for you today. And the treat is we're gonna actually review a medical skincare brand only available to buy from a clinic or someone with suitable knowledge about skin. So it's gonna be a review of ZO. ZO stands for Zainab Baji. This is a US-based dermatologist who originally made a Baji, which I'm a big fan of, Nudum, which is a great, very simple skincare routine, like for pigmentation, and it has actually ingredients that work. So like tretinoin, hydroquinone is one of them. Slightly controversial, but it's very, very effective. So he wanted to create another brand, and ZO came about. So there's so many different products within this range. It's used a lot. There are some good things about the range, and there's some things that are not so good. And we're going to talk to you about, well, if you do go to clinics, how to choose the right products for you and what to be careful of when you're looking at different products. So we're going to go through our top 10 sells. So the skincare that sells the best at my clinics, and we're going to break down each product, and it's going to be essentially a very honest review of the brand.
I really like ZO. I feel like it's a brand that does deliver the results. It gets my client's skin ready before I get them in for clinical treatments. And to be honest, when I send them away with that pre-pack, I know that they're going to come back already with results. I think it's good for lots of skin types. Acne, it helps with anti-aging, pigmentation, and even some cases of rosacea.
So, and what sort of problems have you had with it in clinic?
Sometimes people become a little bit sensitive if it's too aggressive.
Right.
But I feel like they have to just be on the lower form of it and just sort of go for it nice and slowly and build themselves up. People get a little bit ahead of themselves and might use too much of the product too quickly, and they don't listen. So maybe they might get excessive dry, peely skin. But then we just take it back again and reintroduce, and actually it ends up being okay.
So here's the number one product that we sell at a clinic. It's the oil control pads. So who do you use this for in the clinic?
Typically an acne skin type, someone who's excessively oily, a combination skin type. If we're wanting to reduce the oil, reduce the pore size, the oil control pads are a great way to tone in.
So just with pads alone, obviously in terms of environmental things, it's not too good, is it? But oil control pads, these are really, really popular with people with acne. If we look at the INCI list, we look at some of the active ingredients. You've got the salicylic acid, which is great for the skin. It's got mandelic acid,
which I like.
Yeah, and why do you like the mandelic acid?
Because compared to the other toner, where this one's got the additional mandelic, I feel like it's quite calming and soothing. And typically a lot of the acne patients that we see, they do come in with a lot of inflammation. So I like that it's got that mandelic just to suppress that. Okay,
perfect. And it's got some grapefruit extracts in there. So rosé canelina, fruit extract, some wood extract as well. Just hoping maybe even with some kind of like brightening and lightening ingredients. But there are some things over here in the ingredient list that are a little bit, here and there. So like they've got some witch hazel, which sometimes for like rosacea patients is not too good. It can make rosacea a little bit worse. So if you have rosacea, you got to have a bit of caution with this product, even though it's got the mandelic acid. And unfortunately for a medical brand, it's unfortunate that obviously they've got quite a high content of alcohol in there. Which can kind of desensitize the skin and
strip it and
dry it. And it could be too stripping and too drying. And then lower down in the formula, they've also got some fragrance and perfume in there, which again is slightly disappointing because they did add like limonene and linalool in there, which help with that sort of lemony, fresh feel. Including those two ingredients can even sensitize the skin, but having perfume and alcohol is a really bad mix. So if you've previously suffered from like an impaired skin barrier or previously had sensitive skin, this is not going to be a good thing, and it's maybe something that you only use for short term. So if you have like a really kind of small little breakout and you want to control it, this is what I would use. But how I feel about kind of fragrance and stuff in skincare. I'm not a fan of it. So, okay, number 2 is the Radical Night Repair.
That is a 1% retinol.
Right. Okay. So from the notes that you've written, it improves skin appearance, brightens, smooths any texture. It's got micro-encapsulated retinol in there.
Yeah.
So like 1% retinol sounds really strong to people. Why do people get irritated with this, or is it?
No, I would tend to give this to someone if they're a little bit on the sensitive side, well, not sensitive, but they're like maybe like new to retinol, and I want to build them up, because actually, where it's micro-encapsulated, it means it's slowly released into the skin, so you get not as much irritation. So actually, I think it's quite a gentle way of getting you onto a retinol.
So actually, I mean, it's got so many other vitamins in there. It's got vitamin C, E, A. So like, if you're using a very strong retinol, then you'd use like kind of a sandwich method. You'd use possibly something hydrophilic just underneath, so hyaluronic acid, then you might use a retinol over the top of that, and then you might use something to help with the skin barrier as well. So there are a number of different things that obviously we recommend. This formulation is pretty good on the face of it, because obviously you've got a mixture of 1% retinol, good like vitamin C's, E's, as well as things to help with the skin barrier, so some great oils as well. And you know, I think it's got those sort of plant stem cells in there, so it's a great all-rounder and antioxidant for like kind of aging and fine lines, right? Yeah. Do you find it kind of like smooths very well over the skin?
Yeah, I find the application is quite nice, and it absorbs in very nicely.
I mean, there's no surprise, because obviously the first few ingredients are actually silicone, so it's mainly silicone based. So like, you know, silicone, again, it's not great for the environment. It doesn't biodegrade. It's generally non-comedogenic if you look at a lot of articles, but we find that sometimes with products, some individuals with silicone, it does block pores. It can congest a little bit. So you've got to be a little bit careful. If you're particularly acne prone, or you're very sensitive in skin type, then you've got to be very careful. And then you've got the sweet almond oil, which is part of a lot of products nowadays, which is really good for the skin barrier. Glycerin, which is fantastic. Retinol is quite high up in the so it's a good, strong concentration, but we need that anyway. And they've got a lot of great ingredients that will help with that skin barrier, including obviously coming a little bit lower down the vitamin C as well as vitamin E, which is great. But again, you know, what lets it down is that it's this fragrance in here again. So, you know, this is a very strong retinol formulation, and you'd rather it not smell great. Rather than adding perfume into it, because you're going to stimulate that immune system, stimulate that inflammatory cascade, and then you may have a bad association with perfuming products. Now, people always talk, perfume's good, perfume's not. Well, look, if you've got sensitive skin, it's going to be a bad thing. We use perfume in a number of different products on a daily basis. For example, hair, shampoo. But these are not leave-on things. You wash it off. This is something that you're going to leave on overnight. So I would exercise quite a bit of caution if you have sensitive skin, impaired skin barrier, or rosacea with this product. Okay, so the next product, and again, no surprise, is the retinol skin brighteners. Now, I've seen you give a lot of patients this. Why do you like those sort of 3 products that you've got within this range?
I like this retinol because I feel like it helps to clear the complexion and lower pigmentation, and I like it that it comes in different strengths. It's just not one, so you can build it up slowly. So
we've talked about this in our previous retinol videos, the ability to be able to kind of like slowly increase it, so go up the ladder, and then you get more benefits from it. So you've got like a 0.25, 0.5, and a 1% over here. So what's different from this retinol to the other retinol that we talked about just before?
I typically find that people don't get as much downtime with these ones. So yeah, I find, because obviously we do start them on like the 0.25 and build up like that. So I like the fact that they don't get as much irritation from it.
Designed to be a little bit more milder, and we'll have a look at it. So it's a water-based thing, so it'll spread easily. You've got the silicone in there, the sweet almond oil, which is great. You know, cetearyl alcohol was great for the skin barrier, so it's a good alcohol. And yes, we've got apricot kernel oil, so it's a lot more soothing, a lot more friendly to the skin. Some lavender oil in there, which is fantastic. You've got the retinol. You do have some alcohol in there, which again is a little bit deep. So anything with kind of any simple alcohols in skincare can be an irritant. it's great. People include alcohol to try and improve the efficacy of the ingredients, but there are other ways around it now. There's actually non-alcohol versions of like ingredient enhancers that you can use. And what's really nice with this product is you've got a few great ingredients. So you've got glutathione, which we do in like IV drips at clinic, and that helps with like brightening, improving the tone of the skin. So like you said,
lovely glow with that.
Yeah, so glutathione is a fantastic ingredient that's over here. You've also got some bakuchiol, which is what I always say is if you want to lower the retinol concentration in the product and you still want efficacy without it being so drying, you include bakuchiol in there.
Balances it.
Yeah, and in my own skincare, I've done exactly the same, because just including retinol alone at a very optimum dosage can be a little bit drying. So this product is obviously designed to be less kind of drying and a little bit more, let's say, more baby steps and more kinder to the skin.
Yeah, a gentle way of doing it.
And you don't want to get to be peeling. You know, retinoid reactions are not good, especially if you've got perfume in products. So, you know, the only products that I would use that have perfume in it are other ones that are a little bit more milder. But as we come down into this product, let's have a look. We've got bisabolol, all great things for the skin barrier, really, to be honest. And you've got some linalool and limonene, but there's no perfume in this particular product. So, you know, this is actually one that I probably would recommend, because yes, it's got some silicones. You know, obviously a lot of skincare brands don't seem to care for like the environment and stuff, but it's got some citrus things in there which can sensitize, but they're much less than perfumes. It's got some alcohol in there, but it's not terrible. So if there's one that I sort of recommend in terms of a retinol, I'd probably recommend this, because this was not going to desensitize your skin as quick as some of the other formulations.
Definitely. The next product we're going to talk about is one of my personal favorites, which is the Wrinkle Texture Repair 0.5% retinol. I really love this product because I just feel it delivers results. It does what it says. It's brilliant for fine lines, wrinkles, but even deeper lines and wrinkles too. The Z Core Complex is a really good one because it drives the product deeper into the skin. So you're actually going to hit the skin on the epidermis, but also in the dermal layer.
Oh, right. So does it mean that this is stronger than the other retinols out there, or is it pack a bigger punch?
I think it packs a bit bigger punch.
Okay, fine.
And I think it is more aggressive because you do get a lot of downtime with this product, so you do definitely have to build it up slowly.
So let's have a look, because this is your favorite one. So you're going to stand the test of the ingredients to see if there's anything naughty in there. So it's a water-based serum. It's got some good things for the skin barrier, the acetyl alcohols, the cetyl alcohols, great. The kernel oil, lavender oil, all great. You've got some great antioxidant oils with the pelargonium, graveolens, flower oil, which is great for anti-inflammatory properties as well. Then you've got the retinol pretty much in the middle of the list, so you know it's still a good concentration. So 0.5 is probably about correct. As we come down, some great little small peptide complex. So I think this is what they're referring to when they're talking about being able to deliver it a bit deeper down. So simply just some peptides within there, which is great. And as you come down, you've got the linalool, limonene, you know, kind of citrus complex, which, you know, is not, like I said, is not terrible. It is a little bit sensitizing if you want a completely clean brand. But this, all in all, is a decent, you know, kind of inky list over here. So, you know, it's quite clear that they can create something that's not too sensitizing, but this one is probably one that I would go for, because I'd say yes. You know, and that's probably the reason why you've seen such good results with your patients, because it's not going to sensitize you. It might be quite strong, but in terms of its delivery, but it's a retinol works. So therefore this product works. And in terms of retinol, is this more for like acne? Is it for anti-aging, or?
I would definitely say it's more like anti-aging, or even people when they have that like textured skin post-acne.
Right, okay, fine.
It's really good for.
So for like acne scarring and stuff, it's a really useful.
Great product, yeah. Anything texture, lines, wrinkles, but it's also got that Z Pro in there, so it does actually restore the barrier function, so it's not, it's quite hydrating at the same time.
And then this is the one that had like the broccoli extract in there, right?
Yeah.
What does that do, the broccoli extract?
I think that helps to just calm the skin down.
Yeah. So it's like a anti sort of like irritant type thing.
Because it is quite an.
And I think that's quite a novel thing. Like you've got retinol and you're balancing it up with something that you know kind of just stops the irritation. I think that's quite nice.
Yeah.
It's a nice little combination. So the next product is the most popular eye cream that we sell. And you know, I kind of stand by this product as well. I think it's generally a clean product. We'll look at the inky, but it's the Growth Factor Eye Serum.
Yes.
So we actually don't have any in stock.
No, we never have any stock. As it comes in, it goes straight out.
It's gone. So
Flies off.
So we actually don't have any to show you today, but you use it yourself at home, right?
Yes, I love this product.
Why do you like using it, and what does it do for you?
I really like using this product because I suffer with a lot of dehydration, so it's very hydrating, it's very hydrophilic. I find that it just plumps out my little fine lines and wrinkles. It's great for anti-aging.
Yeah.
And it's also good for like dark circles because you've got that lymphatic cooling tip on it.
Oh wow, okay, fine.
It's really nice because you can just do some little lymphatic drainage as you're applying it as well.
I mean, that's a really important thing with eyes, is just kind of depuffing,
yes.
Just helping with fine lines and wrinkles. And it's got that sort of neuropeptide in there, right? So neuropeptide is going to give you a mild, like Botox-y effect. So it's going to relax the wrinkles. So patients that have like Botox and stuff, they use that, and it just enhances the results, right? And then the other thing is, like you mentioned, it's really hydrophilic. So it's got the sodium hyaluronate in there, and it sort of fills those creases and stuff, which is fantastic. Plumps it up. It's got to be one of the most sophisticated formulas out there. I mean, if you're looking at the ingredient list, you've got the silicone in there, but that helps with the smoothness. We've already talked about the advantages and disadvantages of silicone, but you've got glycerin base, so that's the reason why it really kind of helps with the barrier, really hydrating, not drying at all. You've got the wheat germ oil. All of these things are great for people with like impaired skin barriers, and you've got some great plant extracts which are really useful in terms of like helping the skin's natural function. And as you come down, there's nothing really terrible. I mean, obviously we've got different types of silicone there to really help it spread, but that's going to give you that hydration within that area. It's almost got the same type of ingredients that you could need for like a scar cream. That's how much silicone there is in there. But you know, have you, looking at all of these kind of like emollients and skin barriers things, have you ever seen anyone with like getting milia or anything like that afterwards or using this product? Or?
No, not yet. No.
So it's, you know, it's not comedogenic. It's not going to block anything within that area. It's quite a smooth, light formula.
It is very light consistency.
Yeah.
It's very silky,
Perfect. And I mean, look, like I said, it's got both sodium hyaluronate in there, which is a hydrophilic, and then it's got the emollient, which is the gold standard in retaining moisture. And then you've got that cooling tip, which some people say you to keep it in the fridge, right?
Yes, it's nice and cool when it goes on.
Yeah.
It's lovely.
Is that recommended by the company to do that, or do you?
No, I think that's just something that we like.
That's so you might want to check with your clinic, but we recommend that, and I think it's quite nice actually to keep it in the fridge. It cools things down, especially if you wake up with a kind of puffy eyes. One thing I don't think it's going to help with is pigmentation under your eyes, because there's nothing here in terms of the ingredients that's really there for like pigmentation concerns. So if you've got puffy eyes or you've got fine lines around the eyes, it's a great product. And it really helps if you've had like other treatments and facials and things like that. It enhances it, but it's not going to help with pigmentation.
No.
So the next one is an exfoliant. So it's the Exfoliating Polish. This is what it is, by Zena Baji. Now, you said off camera that you like this.
I do. I love this
So
product.
who do you prescribe this for?
This generally is for all skin types, actually, but I tend to give it more to oily skin types, anti-aging, combination, and pigmentation.
So quite a lot. So you wouldn't give it to someone with dry skin, right?
No. I tend to get them on the rest of the range, and then I would eventually introduce them into this, but I would maybe like down the line.
Measure it down the line. Okay, fine. I mean, look, so key ingredients, what are the key things that are working here that are doing the job?
The magnesium crystals.
Okay, so they are, is that like a chemical exfoliant or is it like a physical exfoliant?
Physical.
Okay, so.
And I know sometimes we don't really like the physical chemical.
Yeah, so
physical ones.
I mean, the physical ones that we don't like are the physical ones that we can see, right? But these are like really ultra fine crystals. They're almost akin to having like dermabrasion or safely. So you don't want to really scrub too much. Like what's how long should they be polishing the skin?
So you would apply it onto a damp skin, and then
Yeah.
you would just lightly like massage it in, and they actually
Melt. Almost.
yeah, almost, yeah. And then you just take that off after maybe 30 seconds of doing it, and then rinsing it off.
Okay, fine. And that's after your cleansing and all that sort of stuff,
Yeah,
right?
yeah.
Okay, fine. And then what about the kind of actives that are in there?
So the actives with the exfoliating polish, you've got the vitamin C, you've got vitamin A, and you've got vitamin E in there, which is quite a nice added extra.
So you've got the ACE formula essentially,
Yeah.
which is what I always say is a great formula for everything, because obviously you've got the vitamin A, the retinol, that's going to help with collagen stimulation, help keep acne at bay.
Yeah.
Got the vitamin C, which is your skincare all-rounder, reducing pigmentation, reducing redness, a great antioxidant, and then you're sealing that with vitamin E to make sure that your skin barriers are functioning well. Those are all tips for essentially glowing skin. Now, if we look at the ingredient list, we can see there's magnesium oxide, so that's obviously those little crystals that you're talking about.
Just to add on that as well, because normally I don't actually like physical scrubs, but with this one, because they're crystals, if you looked at them under a lamp, they're fully round, so they don't actually scratch. So
So they've got a round edge,
they're
basically.
rounded, yeah.
Okay, that's a good point. Yeah, so you've got some paraffin in there, mineral oil. There can be a little bit, that can clog up skin a little bit, mineral oil sometimes. You've got the linalool. You've got perfume in there, which is not good. So I can't recommend it now, but you've got the linalool, and you've got retinol palmitate. So it's a very low strength.
Yeah.
It's very light. Retinol palmitate is on the lowest ladder of the retinoid ladder, but it's a great starter. So if someone wants to maybe introduce themselves to retinol, that might not be a bad thing. And then you've got tetrahexyl ascorbate, so it's actually good quality vitamin C, stable vitamin C that's sitting there. So there's a lot of evidence here that you should probably, once you put it on, it might be beneficial to probably even leave on the product for a good 5-10 minutes before washing off. Is that anything that you've ever tried or?
I haven't, but I'm going to.
True. See. So maybe that's a top tip there, but I think obviously there is some evidence, because you don't want to wash some of this stuff off so quickly. I think.
You want to reap the benefits.
You want to reap the benefits, and that's one thing that I like about polishes and things, is that you can use it as a temporary mask sometimes.
Yeah. So the next product that we're going to talk about from ZO is the Exfoliating Cleanser for normal to oily skin types.
Okay, so those are the people that you'd use it, right? So a bit more as exfoliation. Is it a bit more aggressive than something like the polish, or?
A lot less aggressive.
A lot less, so it's just gentle, basically.
Yeah. So this one is obviously great for oily skin types, and it just helps to get rid of that surface build-up of oil. You'd still use it with your exfoliating polish after.
Oh, right, okay, fine.
But or your other polish or your other exfoliant, but you would use this as your cleanser as your first stage.
Okay, cool. So this is the first stage, this is what you do, and then if you want extra stuff, then you'll add the exfoliating polish afterwards. So this is it doesn't strip the skin. Is it a physical exfoliant? Is it a chemical exfoliant?
So it does have the little beads in there, but they actually dissolve on the skin, and they actually feel really nice.
Oh, right, okay, so it just foams up, basically.
It foams up,
okay,
yeah.
fine.
So you've got the gel, it's a gel base, and it foams up, lavas up, and you rinse it off, and it just leaves the skin feeling really nice and clear, and just reduces that surface oil.
And the key ingredients over here?
You've got, I can never say it right, but jojoba.
Well, that's pretty good.
Jojoba esters in there, so that helps to exfoliate the dead skin cells.
Okay, fine. And one thing that really interested me was because we know about encapsulated retinol, but why the encapsulated vitamin E in this product?
It just helps give the skin more of an antioxidant benefit.
But just slowly.
Yeah.
Don't know why.
I don't know why.
Maybe someone from ZO just write it in the comments below.
Why?
Let's have a look at the ingredients list. So here we are. So we've got those jojoba esters, which is fantastic, like you said. Got a few good extracts, which are really nice. Niacinamide, great for the skin
Very
barrier.
good.
Big tick there. Then you've got some salicylic acid. So it's a really nice all-rounder. Obviously, I'm not going to tell you what happens lower down, because it's a running theme, the perfume and and some desensitizing things, which are not great. But I think that if you've got decent sort of normal skin with not much sensitivity, maybe the odd breakout here and then, you want to improve your complexion and glow, then this is not a bad sort of exfoliating cleanser. Would you use this every day, or would you use it? Oh, you use it every day?
Morning and night.
Morning and night. So you'd exfoliate morning and night?
Yeah, it's not an aggressive exfoliator. It's
fine.
mild. It's quite mild.
I guess with the niacinamide, the vitamin E and everything in there,
it can be quite soothing as well.
Yeah, it's a bit more soothing. So it's actually one of the rare things that it's an exfoliating cleanser you can use twice daily.
Yes.
I wouldn't leave it on just because of the perfume and stuff. Like we don't want to sensitize the skin, which is not great. But I think it's a nice, like, mild little cleanser.
It is good.
So the next one is the one that I see all the time in a lot of skincare plans that you make. It's the Daily Power Defense.
Yeah.
So it's a nice name for a serum, right?
It is nice. And it's a really nice staple, I think, throughout all of the whole range. We always recommend this product. It's just great for restoring the barrier function, so you get really nice hydration with it. And it helps with fine lines and wrinkles.
So it's one of the few products within this range that obviously have ceramide. So it's got ceramide 6 there that helps restore the barrier function. It's got matrixyl 3000, so nice collection of peptides. Would have been nice to have some different types of matrixyl in there, like Sin-6 as well. But you know, it's still got some key ingredients that are really quite nice. So look, I'm looking at the ingredients over here. Some good ingredients, glycerin based. Really nice kind of few oils that you were talking about. So the mandarin orange peel oil, which is really nice, citrus lemon peel oil. So all of these things are really going to help with, like, kind of antioxidant properties. And you've got some, I think I saw that there was a lot of peptides in there, which was responsible with the matrixyl 3000, which are great for kind of like building the skin and helping with everything. So I can understand why you kind of build a skincare like plan around this. It's got retinol in there. It's got retinol palmitate in there as well. So two different types of light retinol, just giving you a little bit of collagen stimulation. So it's an all-round thing that even, I guess, when people don't have so much problems, then they can still use this quite nicely. So all in all, a really nice formulation, and you know, not too much kind of wrong with it, and that's the reason why I think I see a lot of patients just using that long term without any problems, and it's one of the biggest sellers. And you'd use that what, like AM, PM, or both?
Both, yeah,
both.
Morning and night. Yeah.
So that's a nice staple serum. You're probably your favorite all-round serum in the range.
I do. Yeah, I really like this product.
And the reason why we don't have it today is because it's sold out.
Yeah.
Okay, fine. So the next one is the growth factor serum. So you like this growth factor serum, right?
Yes, I do. I love this product because I know that I'm going to send someone away and they're gonna get the results. Okay,
what results do they expect?
It really helps to plump out fine lines, wrinkles, firming. It's very anti-aging.
Yeah.
It's fantastic for hydration and helps to restore the barrier function as well.
Yeah.
So again, if people like that injectables and things and they want to maintain it in between, this is a great product.
So this is a great one that you'd pair with the eye cream that we talked about.
Great.
Okay.
Very good duo.
Looking at the thing, you've got these the Budleger stem cells, so it helps prevent future aging. You've got things, polymorphia sinensis root extract, which helps calms and soothes the skin, as well as the ginseng extract, red ginseng extract, which helps with elasticity and firmness. And if you actually look at the ingredients, yes, we've got some silicone in there, which is a little bit disappointing, but those root extracts come up a lot more higher on the list. So it's a very natural, like plant-based growth factor stimulating serum, which is, you know, it's pretty much more like sort of like almost like an IS clinical serum, isn't it?
Yeah.
It reminds me of one of those formulations, which is a nice brand.
Yeah. And I like it as well because I think where you can get good anti-aging results with it without having to go onto an aggressive retinol. So if someone doesn't want to quite go onto a retinol yet, this is quite.
So they'll do
option.
that before there, or they could use it in the day in between when they're like working up a retinol or something like that.
They could do, yeah.
Yeah. Okay, fine. And then the final one, which I think that, you know, I see a lot paired with treatments at the clinic. So if you're having treatments in the clinic and you want to enhance them, one of the ones that we sell a lot of is the firming serum.
Yes.
So that's got a number of different benefits. It's an anti-aging, like breakthrough in the skin structure and shapes. It's mild, lightweight, it's a tolerable formulation, indicated for sort of all skin types, sensitive skin, helps with elasticity, firmness, and it's great for all of those collagen-inducing treatments that you do. So like Morpheus, Soft Wave, like microneedling, Primex, Evoke, and you know, I think it's, again, it's a plant stem cell based formulation. So one of the things that I like is the sodium DNA in this, because it works alongside with the skin matrix in terms of stimulating fibroblast activity. So fibroblasts, what does it produce?
Elastin.
Elastin, collagen and elastin. So that's what you need. So if you're gonna have something that's collagen inducing treatment, then this is gonna be the one for you. If you don't have treatments, then you can probably use some of the other serums that we mentioned in a range. But you know, I think that I see a lot of patients with like daily power defense in the morning and using the firming serum at night.
It's a great combo.
So it's a great combination. So there you have it. Those are the top 10 products that are sold at Dr. Medi Spa. There's some advantages and disadvantages with the range. I do think that this range is not for people with very sensitive skin or people that have allergies or any kind of intolerances. It has to be used cautiously, especially with the leave-on products, just because of the addition of alcohol and fragrance within the formulations. But overall, the ingredient lists are really quite strong. There's some interesting ingredients, a perfect blend of kind of like botanically derived ingredients, as well as things that are evidence-based and proven to work, and some really like kind of, well, ingenious like delivery of things. And I think, you know, the structured increasing of the retinol is one of the most popular things that we see at the clinic.
Definitely so. It's definitely a brand that delivers results.
Yeah. But I would never use this brand by itself.
No,
I would
definitely
always have some professional, skin professional to point you in the right direction, because you need someone that knows skin to be able to be like, say, well, no, stop this, use this just once a day, alternate, or just stop using this altogether and replace it with this. So it requires an innate knowledge of absolutely everything going on. And I always say with Zedo, you learn something new every day, right?
You do, yeah. I mean, whenever we recommend Zedo, we send a structured plan and exactly how to use it. So there's no way that you can use it incorrectly.
Okay, perfect. Thank you so much for listening, guys. If you have any questions about any of those products or any other products within the Zedo range, just let us know in the comments below. If you want to see Ellie in more videos, just click like and subscribe, because then we'll let you know when she's on next.
Thanks, guys. Bye.
Bye-bye.